Jim, hi, this is Brian Noon. Hey, can we do a quick sound and video check with you?
Yes, we can. How are you?
Great, that looks great. Thanks, Jim. That's good. You look good, sound good. All right, so
All right, thanks.
about 5 minutes away. Thanks.
Okay.
Mike, hey, good morning or good afternoon, Mike. Can we also do the same with you, a video and audio check? Media that are on the line, if you want to also record yourself, let me know in the chat and I will make you co-host. Mike, if you're online, can we do a quick audio and video check with you?
All right, can you hear me okay?
Yeah, sounds good. You're on camera. Looks good, Mike. Just about 2 minutes away. Thanks, Mike.
Thanks, Brian.
Brian, can you hear me?
Yeah, now we can. Yeah, now we're good.
Okay, great. Jim?
Again, for media joining, if you want ability to record yourself, please let me know in the chat. I will make you co-host. Okay, just last call for media. If you want to record yourself, please let me know in the chat. I'll add you as a co-host.
All
All right,
right.
Jeremy, I think we're good to go.
Great. Thanks, Brian. Thank you all for joining us today on our continued discussions about what's going on in Nebraska hospitals throughout the COVID pandemic. We appreciate the interest of the media and certainly appreciate the interest of our hospital leaders for joining us today. Last week, I said we were hopeful that we were starting to see the beginning of the end of the Omicron surge. And certainly numbers in the state are heading, sorry, my printer's starting to go right here. Numbers in the state are certainly heading in the right direction. And, you know, we remain hopeful that they will continue in that direction. On the state COVID dashboard, we've seen positivity numbers that are now down to 10.7%. That is a number that puts us about where we were with positivity back around Christmas, and our COVID hospitalization numbers in the state are down below 500 to 496 today, which also puts us around where we were at Christmas time. While the COVID hospitalization numbers are heading in the right direction, our hospitals still remain a long way from normal. We face staffing challenges across the nursing professions, from CNAs to RNs, lab techs, radiology, respiratory therapists, all remain challenging positions to staff, as well as other positions that support the work of our hospitals. Hospitals, certainly our larger systems, continue to postpone procedures, and due to that, we are seeing a backlog of procedures and cases that continue to bottle up and will take us certainly months to work our way out of. And because of that, because of the staffing challenges and backlog of procedures that we need to work through, some of our larger hospitals continue to have barriers to accepting transfers from other hospitals around the state. So we have a long way to go still to work our way out of these challenges, and hope Nebraskans understand that. And as always, we want to continue to remind them to take a step to get their full vaccination and get boosted, because even right now and into the future, that's the best way to prevent us from getting into a similar position. Today, Valentine's Day, certainly no better time for us now than to express our love for our healthcare heroes. And certainly they're on our minds at our hospitals every day. One thing that we're doing at the NHA, the Hospital Association, is partnering it started with Leadership Omaha and the Douglas County Board, and we're pushing it statewide to celebrate Healthcare Worker Appreciation Week in Nebraska, the last day of February 28th through March 4th. Again, the Douglas County Board passed a resolution acknowledging this, and we're calling it Light White for Healthcare. And we're asking Nebraskans that week to display a white ribbon on their window or yard and light up their business, or conduct an act of kindness for the healthcare workers in their life, and sharing a simple thank you. And on March 4th itself, we're asking Nebraskans to wear white and post on social media, if they will, Light White for Healthcare, because our healthcare heroes have been on the front lines of this for over 2 years now. The current increase we've seen with Delta and Omicron started way back on July 1st of 2021, and it's been a struggle for them all the way through that. So encourage Nebraskans to join us in that. Now I'd like to turn it over to two of our great healthcare leaders in the state who have joined us and are going to share what's happening in their facilities and how they see the future in their crystal balls working with COVID. We have Jim Ulrich from York General, CEO of York General Hospital, and Mike Hansen, President and CEO of Columbus Community Hospital. So we'll take some comments from Jim and Mike, and then we'll open it up for questions. If the media does have questions, please go ahead and post those in the chat box, and I'll ask those as we go along. So Jim, I'll turn it over to you first.
All right, thank you, Jeremy. Appreciate it. Happy Valentine's Day to everybody. Jeremy, would you like us to touch on those topics that you had in our opening statement too?
Yeah, absolutely. That would be great. Thank you.
It's great. To tag on with what Jeremy talked about, certainly it's been welcoming to see the downturn of cases. Just briefly, our Four Corners Health District, which includes Polk County, Butler County, Seward County, and York County, back on less than a month ago, January 24th, we had a case rate of 2,089. Now, that's per 100,000 of population. So converted to the Four Corners Health District, that's 928 cases per week of COVID and our new COVID cases in our Four Corners Health District. Today, that rate is 239. Yes, 239. That goes from 928 cases over a week to 106 cases a week. That's a downturn, and it's been going down for every week in between there. So that is definitely good to see. You know, from a staffing perspective to touch on, we have a 15% vacancy rate today in our RNs, LPNs, and aides. And to give you a little tad bit of background, York General is a health system that consists of a critical access hospital, but also a 127-bed skilled nursing facility in the Hearthstone and a 40-room assisted living. And we have a dialysis center too. So they all have nurses that work in those environments as well. So that's 16 RNs, LPNs, and then 10 nurse aides that we would like to hire. And so we have 30 plus positions in our organization that are open today. Now, there's a lot of positions, like one position would be an RN for the floor. Well, that's one, but we need 8 of them, let's say. So that's where the positions are 30 at this time. So yeah, that's definitely an issue. The bed availability in our hospital, today it's more of a staffing availability and how many we can staff. And the acuity of the patients that we see are much higher than maybe we had traditionally seen, let's say pre-COVID. And we were as high as, I'll tell you, about a month ago, we had 5 COVID inpatients, and we're a 25-bed critical access hospital. So that greatly limits our overall capacity otherwise that we have in our organization, particularly when we're limited by staffing as well. And the COVID patients typically were one-on-one care. They were pretty sick individuals. We don't have any COVID inpatients today. However, we're still within 1 or 2 beds of pressing our staffing availability that we can take on just for staffing our beds, which typically is more. Today, it's only like 12 or 13 that we can take. And that doesn't include our OB, so that'd be 15 really that we can take out of our 25. We want to get very quickly to about 16 to 19 through hiring additional staff and maybe a little bit less acuity that we have on some of those patients. We'd love to get to all 25, but we're just not there in our staffing right now that we have. You know, probably on another good front, overall, the transfers are better out of our organization. The COVID transfers have been an issue now and again, but again, we don't have those now, but we've been able to get them out for our organization when they needed to be, when they became more compromised. It just may take us an extra day or so when we do that. It's getting much better for the traumas and the strokes. That's great to see for our organization of our size. And it's a lot of the general medical, like the sepsis patients and those that are pneumonia, when they really, typically we could treat those, but because of staffing limitations, maybe we need to move them on. And so those have been a challenge now and again, but overall, those have been getting better. So I know we also want to talk a little bit about monoclonal antibody injections. And it was a couple of weeks ago, we were limited to, there were state limitations of allocations, and that's a little bit better. We have plenty of doses of the Merck pill that we have, instead of the injections, the pill. And we had 20 to begin with, now we have 30. We have seen overall that more of the patients would prefer if we have the availability of the injection still. We've been able to utilize those doses, but we have plenty on hand right now. So back about a month ago for the sotrovimab, the monoclonal antibody injection that is more effective on the Omicron variant, we had given about 20 or so of those every week, and now that's down to about 8 this last week. And we do have, we're scheduled to get about 12 of them in this next week, and we do have a pretty decent supply on hand as well. And so those are all really positive things, I think, that are showing in this trend. So how about the impact on our healthcare workers? How do they feel? Tired, getting better, I would say overall, but it's not the fear of the unknown that maybe we had at the beginning of the pandemic. It's just the wear and tear of that. And it's a little bit of COVID fatigue, but again, much better right now. And that definitely, if it applies to our hospital, boy, in our nursing home, it really does. When you have one positive resident, they're in secluded zones. So you got the pressure of families that want to have visitations too, that we aren't able to accommodate. So that is all getting better. We're all free of that right now in our nursing home environment too. So to close up really, what wears on our staff a little bit now too is we're starting to see influenza creep in our organization as well. So it's like, oh, we just get over COVID and here comes influenza plus the high acuity patients. So we are trying to celebrate as we can with our staff and give them little goodies, give them little things that will help along the way with morale, and definitely communicate where we are. And so there's not that fear of the unknown. So Jeremy, I think I better limit my comments to that right now. Thanks.
All right. Thanks, Jim. I appreciate those insights from York. Mike, over to you in Columbus.
Yeah, thanks, Jeremy, and thanks, Jim. So we have been at this since February 27th of 2020. So it's almost 2 years now that we went into incident command. And first and foremost, I want to say that Nebraska hospitals have had a heroic response to the COVID pandemic. Great collaboration throughout the 2 years with our NHA and Dr. Antone, the state medical director. Great collaboration with our local public health departments. And then also our Medical Emergency Operations Center, which we set up back in November of 2021, I believe it was. And just a lot of different collaborations going on there to help us plan and strategize as we continue to fight the pandemic. As far as the workforce, we've been through 4 surges of COVID now, the latest being the Omicron variant. The worst of it was back in November of 20 when we peaked at close to 1,000 hospitalizations. This last surge, we peaked at about 767 hospitalizations statewide. We've been steady busy with COVID patients. I think we've had 1 day where we did not have COVID patients in-house here. And again, Columbus Community Hospital is a mid-sized hospital. We have over 900 employees, 50 beds in our acute care unit. And staff are tired, staff are fatigued. What keeps me up at night is worrying about my staff's mental health. Workforce issues are becoming a problem. Jim mentioned staffing now being the bigger problem. And so that's something that we continue to worry about. And workforce going into the future is a concern because, we had a nursing shortage prior to the pandemic, and the pandemic has just exacerbated it in a number of ways. And so getting nurses in the profession is going to be a challenge, for the foreseeable future. I also worry about reimbursement. Obviously, Medicare and Medicaid is a big payer for us. About 50% of our revenue comes from Medicare and Medicaid. So, looking at what Medicare and Medicaid is going to do to respond to reimbursement in the next couple of years is going to be something that we're going to watch. And so that is a big concern. What else? As far as our treatment here, our doctors have done an outstanding job. In the very beginning, we learned a lot from what happened on the East and West Coast. We got protocols in place that really helped us deal with our patients. So I think we did a great job caring for patients. There were times when things got really busy where we were full, and transferring to Omaha and Lincoln was a problem, but I want to thank the state for really stepping up with the hospital decompression program that has helped tremendously move people out of acute care beds into long-term care beds. So that has relieved some of that pressure. And again, physicians have done a great job using the monoclonals, the antivirals, the remdesivir. We've used all the tools in the toolbox to really help us navigate our COVID patients. So we've been very fortunate here in Columbus and in Nebraska, I think, in limiting the number of deaths that we've had in Nebraska because of the great care that our hospitals have delivered over time. So those are the things that I worry about now. We still do have COVID patients. The general public doesn't recognize probably that we're still in this battle. And our staff have sacrificed a lot in terms of their personal families and themselves in being here. And again, I just worry about them and their well-being. And so that's something that I certainly will focus on going forward.
Thank you, Mike. Thanks for those comments. As Mike mentioned, the state decompression program we've talked about a couple of times on this call, but those beds are up in Lincoln, and more coming online in Omaha and Grand Island, and really important to give our hospitals a additional breather here as we remain at relatively high levels of hospitalizations. We're coming down off the peak, but this will give them a chance to move patients out that don't need to be in an acute care bed, and hopefully help with some of the staffing limitations that we have. Julie Anderson just asked, so the Lincoln facility is open and either full or very near full. The Omaha beds will come online this week. The state has signed the contract for those. And also we think Grand Island's contract will be shortly after that. So combined, that'll be north of 70 beds, and then possibly another dozen or two added in Lincoln after that. So that's just important. We talking to some of our larger systems this morning, just talking to two systems combined, they had about 50 patients still ready to move out immediately to a skilled nursing bed if it was available. So that'll certainly help with hospital capacity. We have another question. How concerned should Nebraskans be about hospital capacity now that the number of hospitalizations has eased over the past month? Would Jim or Mike like to take that one?
Well, I'll go ahead and start out, Jeremy. We have a lot of other patients aside from our COVID patients, and we have that backlog of people that were waiting to get elective surgeries done. We have, a lot of people that weren't getting care during the COVID pandemic, which is almost 2 years now. So we are starting to see a lot of other types of patients in our hospital, and we're starting to see a lot sicker patients in our hospital. So there's still, a concern about capacity. And then as Jim and I both mentioned, more than the capacity is staffing those beds and getting the qualified professionals that we need.
Jeremy, just to add to Mike, thank you for that, Mike. That's well stated. And our emergency room, I would say over the last 8 months at least, has been probably 15 to 20% higher than what we'd seen before. And it doesn't seem to be letting up. And as Mike said, you might have some COVID patients that do come in, but by and large, it's other illnesses. I mentioned influenza, I mentioned higher acuity. We have been able to do some of our elective surgeries probably as a percentage of schedule, probably more than Mike has been able to for capacity reasons, but there's still a backlog there. And there's still people that have the illnesses after COVID as well. Some other respiratory illnesses going around, the influenza, like I mentioned. So, and they're just sicker folks. They really are. And so I'm still concerned about it with the staffing levels that we're able to have. And I feel better if we had all the staff that we needed to care for the community. We care for them well. We do. We make it work, but it comes at a sacrifice, as Mike said, from our very dedicated and hardworking staff.
Yeah, and the numbers that you mentioned about just the increase in emergency room volume is something that we're hearing from hospitals across the state. I was just down in Southeast Nebraska on Friday visiting a few of our member hospitals, and similar thing, their ER numbers are up pretty substantially as well due to a mix of illnesses going around. Any other questions? Those are the only two we have so far posted in the chat box. Any other questions out there today? Going once, twice. Well, as always, if any members of the media have follow-up questions, please feel free to reach out to us at the Hospital Association. We're always willing to help connect you to any of our hospital leaders to talk about what's going on with them. Looks like Jim and Mike are going to get off a little easy today. So thank you all for your time and participation.
Thanks,
Jeremy.
everybody.
Thanks, Jim.
Bye-bye.